I want to welcome everybody. I do have some sad news that we are not going to have Dr. Poonam Sharma with us today. She had a family emergency this last week and she sends her regrets. And we also send prayers and good vibes with her family right now. But she did want me to go ahead and continue with the program. So it's just going to be me today. Um, Dr. Sharma, I kept her name on here because she did so much work together with me on these slides and on this presentation. So I wanted to keep her name on here. There's going to be some slides that I may not talk a lot about. They will be there for resource for you, but they might have been a heavy story for Dr. Sharma. And so we might be skipping over some of those a little bit lightly, just to let you know. But we do want to welcome you to Fostering Psychological Safety. And this is one of our sessions in the Health Sciences Professional Development Series that Dr. Sharma and I have put together. Let's make sure we're clicking through. You can see the next slide.
Yep, it's coming through.
Okay, great. So let's go ahead and give a little time here. I'm going to pause here so that you can get on Poll Everywhere. You can either take a picture of it with your device. You can get on the website. You can even text my name to 22333. But let's pause to let you get on right here. We just have a few questions on Poll Everywhere, but some things you don't like to say out loud or you don't want to put in the chat, and we want to respect that privacy. If you're not able to get on Poll Everywhere, then you're welcome to put things in the chat as well. You're also welcome to unmute yourself during this session. We are recording this session and we will share the video out with participants, and we will share those slides so that you have those as a resource. All right, let's jump in. And as you know, Creighton as a Catholic and Jesuit university, we love to start things with a reflection. And this is from Charles Duhigg, who is a Pulitzer Prize-winning journalist. And he says, teams need to believe their work is important. They need to feel their work is personally meaningful. They need clear goals, defined roles, but members need to know they can depend on one another. And most importantly, teams need psychological safety. So as you're thinking about your own team today, it might be a team in an office setting. It might be a team in a clinical setting. It might be a team in a hospital setting. It might be a team in your family setting. Whatever your team is, I want you to always keep thinking of your main team as we talk about teams, as we talk about learners. We're all learners, we're all teachers of those around us. And so don't always think about this as just a healthcare team. There's a lot of different teams that we can be on, but what's important is that there's psychological safety, and that's what we want to talk about today. So our path today, just a few objectives, is we want to understand what is psychological safety and how does it impact healthcare and our healthcare education? How does it impact your team? We also want to identify factors that might hinder psychological safety or support psychological safety on teams. And we also want to share practical strategies, and you're going to already have some that you're going to be able to share. And then I also have some from Dr. Sharma and myself that we would like to share with you as well. And neither one of us have any disclosures or conflict of interest. One of the things that is so important, especially in the healthcare education environment that we are in here at Creighton, is that we have Jesuit charisms, we have Ignatian values, and they might seem kind of wide, they might seem global, they might seem like this huge umbrella of ideas, but what do they turn into? They turn into excellence in our academic and education setting. They turn into lifelong learning for our learners. They turn into understanding of religious differences. They turn into education of the whole person. And that might mean intellectual, professional, spiritual, or moral, physical. As we're teaching, as we're working with learners, we're thinking about them as a whole person. It can also turn into promotion of faith that is doing justice out in the world. It turns into these values and charisms really look like respect and dignity for other people. And what we're really essentially doing is forming men and women that feel competent, that have a conscience, and they have compassion. So as we're talking about psychological safety and we're thinking about the Jesuit charisms or the values that we hold true, they might be a little bit different than what we have here. They might be a little different for you individually, but your values and your standards should be turning into something tangible. And for us here at Creighton, we want it to turn into these things here on the right. We want it to turn into something tangible. Now, the catch is that sometimes our teams may feel like this. We may feel crowded. We may feel confused. We may feel like we're not quite sure what our responsibility is, or we may feel like other people's understanding of their responsibility might be a little crowded, or they're not quite sure what their role is. We may feel like there's too many pilots, like we see here at the International Space Station with these astronauts. We might feel like we're not being heard. But what I want you to think about in whatever team you're on, whatever team you are in, I want you to think that you are part of a team and you are a pilot. Whatever pilot role that takes, there's certain responsibilities that you have on your team, and it requires a multifaceted team. We have a lot of different moving pieces. We have a lot of different wires going all over the place. We have a lot of different people that we need to communicate within our teams, and that communication has got to be bi-directional. So it's going back and forth. So it doesn't matter if you're a supervisor of a team or if you are a member of a team. There's got to be communication going back and forth. And one of the things to keep in mind as you think about being a pilot in a cockpit, the FAA regulations for any commercial flights is that there is a requirement of at least 2 pilots. So there's always a captain, there's always a co-pilot, or they could even have some of the same responsibilities, but they're just checking on each other. So they could even have the same title within the plane cockpit. But there's a reason, there's a regulation from FAA. There's a reason there's a regulation on that, is because we need to check on each other. The pilots need to check each other. And we can't be offended by having other people also in the cockpit with us, on our teams with us, because they're checking in on us. They're double checking work, and we might be double checking their work. So kind of be thinking about your team in that way as well. The key ingredient, though, that we're going to be talking about today is the psychological safety. In order to be able to communicate back and forth, we really need to feel psychologically safe on our team. So let's have our first question with Poll Everywhere. One of the quotes we found, Dr. Sharma and I, is having something to say yet feeling unable to do so is painfully real for many employees, no matter what type of work you're doing, whether it's healthcare, whether you're out in retail or in business someplace or in a private organization. Many employees feel that there is um, something stopping them from being able to say or say what they're feeling, say what they're thinking. So we're going to ask you the question, have you ever felt this way in a classroom or clinical setting? And I realize my poll everywhere slides are a little funky looking, but let's see if we can get responses to show up. Robbie, are you able to actually answer the question on your device?
Yep, I'm able to answer it.
Okay, and I forgot to give a shout out to Robbie. He's helping me behind the scenes a little bit, and he's going to be monitoring the chat as well. So shout out to Robbie, our instructional designer in School of Medicine Faculty Development. Okay. I wonder what I'm doing wrong that I can't see the responses. Okay, there we go. Can you see responses a little bit?
We can see from your screen, yep.
Okay, great. Sorry about that. Whenever we're using technology, we're just having to be a little bit flexible. So we have a lot of yeses. I can't see the percentage there, but we do have a lot of yeses. I don't know why the screen is so big. But we want you to think about, what did that feel like when you were afraid to say what you felt, when you were afraid to ask a question, when you were afraid to speak up, when you were afraid to say something and maybe you were just a bystander or a listener, but you felt like you needed to say something. So just kind of keep that in your mind as we move along. Edmund Burke talks about this kind of fear when he says, no passion so effectually robs the mind of all its powers of acting and reasoning. So we can't take action. We can't reason things clearly in our mind if there is fear in our mind or in our heart, or fear of saying something. It's great to hire talented people, but all of the people that we hire, all of the people on our team need to feel safe. Safe to learn, safe to experiment with something, maybe something new, maybe a new idea, and to flourish, to feel like they're actually growing and doing something more within the teams that they're on. So super important to not have fear, but to have a feeling of safety. And that leads us to some ideas about psychological safety. I'm not going to read all of these to you. The thing that is most important to remember here, it is not about being just nice or lowering your expectations. And we're going to talk about how important it is to actually keep expectations high as we are keeping our psychological safety high. So it's not just about being nice, but it is crucial in organizations where the knowledge is constantly changing, and especially in healthcare, right? And in education, and in higher education, especially. knowledge is changing all the time. The kind of learning, the way that our learners learn and the way that we're teaching is changing all the time. So it's super important that we're keeping those expectations high, but we're also keeping psychological safety high. It is really important too. I just want to read this last line here. It is that high performance can only develop in a psychologically safe environment. So it's not just about being nice. It's not about lowering expectations so that everybody feels like they're walking through a field of daisies, but the idea that something high performance and new ideas can only develop in a place where they do feel safe is what's so important here. And it does exist when you're not afraid to be yourself. You're not afraid to raise any kind of problems. You're not afraid to respectfully disagree. You're not afraid to ask questions like, tell me more about that. Oh, I'd like to know more. Tell me more about what you're thinking, or taking some risks within your teams. It actually gives people permission. It empowers them to be honest, candid, and sincere. So that's the kind of psychologically safe environment that we want on a team. So let's go ahead and look at the research. Several studies have been done on the learning environment, especially the healthcare learning environment. And you'll see a lot of these are coming from surgery or operating room, other kinds of healthcare situations. There's a lot of research out there, but what does it actually tell us? It tells us that there is a positive correlation between having psychologically safe environments and all of these things that we have listed here. And we have taken these straight from the results of different studies. So positive correlation with how high the psychological safety is and the clinical outcome or the quality of care. So as the psychological safety goes up, so does the clinical care, so does the learning, so does the knowledge, so does the retention. Learners engaging in activities goes up because they're not afraid to make mistakes. They're not afraid to ask questions about what they're doing. They're not afraid to say, tell me more about that. I'm not sure I understand. Or can you show me that again? Their overall well-being goes up, but guess what? It's going to go up for you as well. Not just for the learners on your team. It's going to also go up for the overall well-being will go up for supervisors as well. So team performance, high individual and team performance goes up as well. So to put it in very simple terms, we've got the highs and the lows. If you have high PS, psychological safety, you're going to have a strong performing team. And there's going to be great experiences for learners, but also for patients when this is a clinical team, a hospital team, a healthcare team. And it doesn't matter what the health science is. It could be medicine, it could be a specific program within medicine, it could be PT, it could be nursing, it could be pharmacy, whatever that team is. But if there is low psychological safety, there's some dysfunction that's going on. And you might have been on a team before where there was some dysfunction. There are even studies done that have nothing to do with healthcare, that have nothing to do with clinic. And this was Google's project. And they found that there was a 56% increase in the product launches, new product launches. So innovation really goes up when there is a psychologically safe team. There was a 5-time increase in problem solving, productivity, employees speaking up and saying something. If they noticed something was going wrong, they were able to say something about it, and it actually increased productivity because they didn't need to go down the road of a mistake. And there was 50% decrease in turnover. People want to stay on those teams, right? So we thought it was important to share with you some of the studies that are out there that are also finding this to be true when it's not even related to education or healthcare. It's all the way around. I want to show you this chart that talks about the learning zone. And this is really where we want to be. We want to be in the learning zone. There's 4 different zones here. And we're going to talk through this just a little bit, and then you'll be able to have these as a resource, the slides, so you can be able to come back to these. We're not going to read all the words on here. But the idea is that when you are increasing accountability, like we do expect you to perform. We do expect you to learn something. I have expectations for myself as a leader on a team. I have high expectations for myself, but when there is also high psychological safety, we are now in the learning zone. And it's possible in this learning zone to give really tough and critical feedback. And in a healthcare setting or an education setting, it's important to give critical feedback. They need to know, learners need to know what to do next. But it does require trust and respect. So here in the learning zone, you can focus on collaboration. And this study was actually done, the quadrants here are talking about hospitalists, healthcare, and this was done by Amy Edmondson. And I've got some resources from her a little bit later on in the slides. But Amy Edmondson wrote the book, The Fearless Organization, and it's all about providing a psychologically safe environment for our teams. But if there is not high accountability or high responsibility, like we don't have very high expectations of you, you kind of get in the comfort zone. Everything's warm and fuzzy. We're walking in a field of daisies. And if there's low psychological safety and low accountability, I'm kind of going counterclockwise here. So learning zone, I just talked about the comfort zone, and now we're going counterclockwise down to the bottom left-hand side, the apathy zone, where they don't feel really safe, so they don't want to speak up, and there's really low accountability. So it really doesn't matter anyway, because they're not really responsible for anything. Nobody's checking up on them. So there's kind of this apathy, and they don't feel like it matters if they're going to say anything anyway. And there's also, as we move to the next zone on the right bottom side, the anxiety zone. Lots of responsibility, lots of accountability, but low psychological safety. And this is where we find a lot of healthcare environments or healthcare learning environments have a lot to learn. Learners have a lot to do. They're working 80 plus hours a week. I didn't say that. They're only supposed to be working 80 hours a week, right? If they're residents, but they're on really long rotations. They have a lot of information to learn and then to regurgitate on their tests. So they have this huge responsibility, but they don't feel safe to bring anything up. They don't feel safe to ask questions, and it creates more anxiety. It creates more stress. It can create depression. It can create burnout. And you know what that looks like. That is a whole nother talk in itself, right? Is the anxiety zone. But just know that when we have really high PS and we have high accountability, we are requiring things of people in a safe, respectful way, that we're in the learning zone, and that's where we want to be. So I was going to do a word cloud here about some barriers to achieving this psychological safety. I do not know if the poll everywhere is going to be nice and let us do this. I'm going to try it though. So the question is, what are some barriers to achieving psychological safety on your team? Now, in a word cloud, you need to keep your words together. So you either need to put them in together with a dash if you have two pieces to your barriers, because otherwise the word cloud will split them up into two separate words. So just put your words together somehow. You can just type all the words together or put a dash or an underscore in between them. So really the question is, what makes it difficult for your team to feel safe, to speak up and to share ideas? I might need to get onto this actual question and just activate it. Yep, it looks like it's activating. Are you able to type in words?
Yep, it's activated.
Okay, great. There we go. And oh gosh, I'm so sorry. It's not gonna play nice for us. But we can kind of see non-safety or not good definitions, good, somebody's like, it's not very clear. So that could be a barrier, right? If we don't have good defining roles, different personalities, exactly, low communication, our time can really add to a barrier. Absolutely. Not having good connections, belittlement, talking down to people. Absolutely. Thank you for that. I'm gonna have to have somebody check out my pull everywhere so that it just works a little better. So let's talk about some of these things that undermine psychological safe environments, especially in healthcare settings. Sometimes there's a hierarchy and there could be some power imbalances. We might blame people. We might blame those that are on our team, or we might blame another team altogether. So maybe our team, we feel really great, but we're talking poorly about another team that we thought, oh, let's blame the team that was here yesterday working with this patient. So it kind of creates a negative culture within our own team when we're blaming somebody else. Some of the things you already said. So not having a clear, these are the expectations for my role, right? Any kind of fear of alienation, not feeling like you're part of the group. If you say something, that lack of inclusiveness, any kind of external pressures. So some things a little more about the hierarchy and power dynamics. Some people have said a lot of people are still in awe of physicians and they will not question them. And is that a place that you want to be in as a healthcare provider, that a patient, a learner, another team member doesn't want to say anything to you because they're like, oh my gosh, you're a physician. You've gone through so much schooling. You are so good at what you do. You're the best surgeon here at the hospital, or you're the best internist here in our clinic. But do we really want to be thought of as somebody that can't be approached? You could be a superstar intern, but the moment you walk into the clinic, there's hesitation and you become a nobody. So sometimes people feel like they've done all this work and they know so much and they really want to keep learning, but then they're back down to the bottom of the totem pole when there's some power dynamics going on. And that's our last quote as well, the bottom of the totem pole. But here's something to keep in mind. Can we really get rid of hierarchy? There will always be a hierarchy of responsibility. And that's because somebody needs to make the final decision. So they're getting all the information about from everybody on the team. Maybe they're talking to the PT and they're talking to the pharmacists and they're talking to nurses and they're talking to the physicians, but somebody's got to make the last decision, the final decision for the patient. They've talked to the family, they've talked to the patient, and somebody on the team has got to make that final decision. So there is going to be a hierarchy of responsibility, and we can't be offended by that. Somebody's got to take responsibility and make that decision. But there should never be a hierarchy of respect, not with the patient's family, not with the patient, not with the learners, not with our physician residents, our attendings, our med students, our nursing students, whoever is on our team, whoever is a member of our team, there should never be a hierarchy of respect. Respect should be going back and forth continually. That's how we create a psychologically safe environment. And we talked about these, and some of you had these on there, on your cloud, your word cloud, micromanagement, any kind of unfair treatment. And a lot of these can escalate and they lead to something we call disruptive behavior. Disruptive behavior is poison that can kill any kind of culture that you had going for you, any kind of positive culture that was happening. It could be anger. It could be being dismissive to somebody, being passive, not sharing your ideas, not sharing your thoughts because, oh, it's not important for them to hear about it. I'm going to make the final decision anyway, or any kind of aggressive behavior. This is all disruptive behavior. Now, this kind of culture can go beyond your team and it can explode. It can be a huge umbrella over a lot of different teams. It could reach to a level where nobody feels safe anymore with whatever your business is, whatever your team is, whatever your clinic is, your hospital, because the culture was so broken. And there's a few of these, I'm just going to go a little bit quickly through, but the whole system then becomes a barrier. There's a really, really high workload, but then there's this reluctance of handling unprofessional behavior because they might be really good at what they do. So it's important that we address some of those things. There's been lots of sessions on rising up against mistreatment, Title IX sessions, and we can get you those if you would like any of those slide presentations or video sessions. We can get you some of those. I do want to mention Dr. Jo Shapiro. She has done a 12 video series, and the videos are not very long, but she's done a 12 video series. She's the second one from the right in the blue shirt, the blue scrubs. And Dr. Shapiro has for decades been talking about psychological safety and not having any kind of disruptive behavior or mistreatment in the clinical setting. And these 12 videos are on Harvard's continuing education site, Harvard Medical School. And when you get these slides, this YouTube picture right here is hyperlinked to the video series. So you will be able to get on those. But she has done a really great job talking about unprofessional behavior and why we have put up with it for so long, especially in healthcare settings. She talks about a culture of influencing outcomes and how our culture can actually increase patient safety, not just their safety, but their actual health outcomes. So She also talks about peer support. She's just got a lot of really great stuff that we wanted to bring to your attention. Now, here I know that the poll everywhere is not working very good, but you can still add some things. You can also put it in the chat and Robbie can read those out to us. What do you think can be done to provide a safe space? Because that's what we're going to be talking about the next 20 minutes is what are the strategies for creating this psychologically safe space where people can voice their concerns or they can ask a question? So if you can go ahead and type some of those in, and then I'll see if I can click responses here. See if we can see those. If you're not able to get on, you can certainly do it in the chat and we can read those out. But we've got inclusion, of course, including people, any kind of training on psychologically safe environments, you bet. Helping people have courage and giving them that courage, giving them permission to have courage. So what does that look like? We're going to be talking about what that actually looks like as we hand courage to people. Show that it matters to leadership. So if you are a leader, a supervisor, a manager of a team, then you are actually saying, hey, this really matters to me, right? Vulnerability, encouraging vulnerability, you bet. Having a shared voice, not just the leadership's voice, but a voice from everyone on the team. These are really great ones. Thank you so much for sharing. And we are going to talk about some of these. We're going to dive in a little more. And what we want to do the next few slides is actually build your toolkit for building some more psychological safe environments. And these are simple actions of faculty, leaders. Doesn't matter what your part is on the team, but these are things that you can do. So think about what characteristics did you admire in your own teachers and your own leaders? I know you've had some good ones. Maybe you've had some poor ones and you don't want to repeat those, but emulating what you liked in a teacher. It's kind of like the idea that, oh my gosh, I thought I would never say that, but it's exactly my mother's words coming out of my mouth, right? It's the same idea with teaching, with leaders, with managing. We hear things in our ear, we hear things in our mind that somebody has already said to us that was positive, and we want to repeat that. So emulate those things. Do what your mother said. And you can also use the golden rule. What if you were in the student situation? What if you were in this learner situation? And maybe they just got yelled at. Maybe they just made a mistake. What does your team do to help that learner learn something in a safe environment? Always use the name of the team member whenever possible. Learn their names. I know sometimes rotations, the learners are coming and going. Maybe they're only with you for a few days and then they leave and they're on another specialty or in a different program. Whenever possible, learn their names, say it to them, say their name back to them so that you can make a connection with their face. And it leads into our make eye contact. So listening with your eyes, but those kinds of things really build community and student engagement. They want to say something when they know that you know their name. And maybe you don't know a lot about this learner, but you know who they are. You have expectations for them and you have a safe place for them to say what they need to say. I had a learner come to me one time, this was just a few months ago, and she was working in family medicine on a rotation. She was a third or fourth year student and in a family medicine rotation. And she went in with a patient and she was listening. And at the end of the patient interview, the patient looked at her and said, I know that you are going to be a great doctor. And she said, really? Oh my goodness, that makes me feel so good. But why do you say that? And he said to her, because you listen with your eyes. There was eye contact going on. And truly, there was some things she didn't understand, and she was going to need some backup, and she was going to need some help with the person that she was shadowing. But when she was listening to the story of the patient, she was making eye contact. She was listening with her eyes, and the patient noticed that. So those are some simple things that we can do. The golden rule, using the name of the learner, emulating what you like, and making that eye contact. Really important. Now, here's some others that Amy Edmondson from her book also have in building your toolkit. So as we're setting the stage and inviting participation, what can we do? We can emphasize the purpose. Why are we doing this? Why are we sewing up the patient this way? Why are we putting the tube in this way? Because maybe that's not how they learned it when they were in a learning environment or doing it on a simulation, but now in real life, it looks a little different to them. So what's at stake and why does it matter? Human life is on the line when we're working in a healthcare setting and when we're teaching learners in a healthcare setting. But it's important too to demonstrate humility. So yes, this is really, really important. And yes, I do know how to do it. And yes, this is why we do it this way. But as we demonstrate humility, it really gives us a learning mindset. Like I can learn something new, you can learn something new, we're learning from each other, and I don't have all the answers. And it's okay to say, I'm not quite sure about that. I'm not quite sure why we do this, or I'm not quite sure what we're going to do next, but we're going to find out. And that's going to be our job tonight as we're going over our cases. Okay. It's also important to have appreciative inquiry. Sundar Punchai, I've got his resources and reference at the back of this slide presentation. He is the CEO of Google and also Alphabet. And he says to empower your team, you need to ask questions and you're going to suspend judgment, but you're going to say things like, help me understand. Can you please tell me more about that? Somebody has a brand new idea and Sundar says, can you tell me more about that? I want to understand what you're talking about. So just some simple phrases like that can really help in someone feeling appreciated that they spoke up, someone feeling safe in their environment that they can speak up. Another part of the toolkit is responding to someone productively. So a continuation of appreciative listening or appreciative learning is expressing appreciation, and it drives out fear. So you're listening to someone, but then you're actually showing gratitude by saying something. And it doesn't take a lot of time. By just saying, thank you so much for sharing your idea. I really appreciate when you share something new that we haven't heard before, but at least acknowledging it. Thank you for that idea. I don't know if that's going to work this time, and we don't have a lot of time to think about it. So we're going to go back to something else, but I want to hear more about what you're thinking about. Just some words like that that might take 30 seconds for you to share. Destigmatizing failure. So let's study together. Let's do some research together. Let's learn together. Let's move forward together. I'm going to offer some help. Maybe the learner is needing a little more assistance than what we're thinking, but let's talk about it and let's consider some of your ideas and brainstorm for next steps. It just helps someone feel like what they're bringing up could be a possibility. and it makes them feel like they could bring up other ideas at another time. So as you also set up structures and processes, it creates forums for input so that they can say something, but it also gives some guidelines. So it's okay to set up some guidelines within this frame. What could we do differently? Or if we're looking at it from the patient's family's point of view, let's do a different kind of POV here. And let's find out what kinds of things do you think they would be thinking of? So it's okay to set up some kind of input frame, but you're setting that structure as a leader. And then there's also, of course, shared expectations, trust, and respect that come from any kind of accomplishment. It's not just you that accomplished the good things that are happening with either a patient or a family or a procedure. It's the whole team. So making sure that those accomplishments are shared with everyone, because then they want to try again to do something different. So there was a study done by Rebecca Lynn Williams, and she specifically is talking about the surgical learning environment, but you will see very quickly that these work for a lot of different learning environments. So if a learner has a question, what would be psychologically safe and what would be unsafe? Just to give you some ideas. So a learner has a question, and if the learner feels empowered to actually ask for some help, if someone is asking you for help, they feel psychologically safe. If they want to get new knowledge or skills and they're coming to you and saying, I would really like to learn how to do this, I can see that you're doing it really well. You know that you have created a team of safety. But if the learner is afraid to even ask and they're not asking you questions, there could be some opportunity for growth there. If a learner, let's go to the second one, if the learner notices a potential error and the learner feels able to bring it up, to actually mention it, to say something about it so that the event could be avoided, then you know, you don't need to take it personally. You know that they feel psychologically safe and you helped create that culture. But if a learner is afraid to even bring up their concerns and something bad happens, then the team was not feeling safe enough to bring something up. Now, it doesn't mean that's the case every single time. There could be a mistake that everybody missed, right? But if there is a potential error and someone brings it up, there's no need to feel like taking it offensively or taking it personally because you have helped create a safe environment. Whoops. And if a learner makes an error, because this happens a lot, right? We have learners that make errors, especially in the healthcare settings. But if they feel comfortable admitting their mistake and saying, I am so sorry, I've got to learn how to do this better, and they can self-reflect, then they're learning from the experience. But if there is shame given to the learner, they really don't learn from the experience and they're not what we call failing forward. We want learners to fail forward. As they fail, and they're going to make mistakes because we all make them as well. As teachers and learners are making mistakes, we want them to learn from the mistake and not feel shameful about it, but say, what can I do to make this up? How can I avoid this next time? Here's some other ideas, and these are just bringing the toolkit all together. And what I'd like you to do of these 5, I would like you to choose one of these areas. So you've got a little bit of homework. I'm not going to be checking up on you though, but I want you to choose one of these areas to focus on right now, tomorrow, as you are working with your teams. There's creating psychological safety with making it a priority, saying it out loud. I want this to be a safe place. I'm going to be explicit about that. I'm going to say it out loud to my whole team. Or am I going to facilitate something? I'm going to facilitate everyone being able to speak up. And I'm going to do that by them writing it down and we're all going to read them together. Or each person is going to have a turn talking about their concerns, but allowing everyone to say something, whether it's written or verbal. Establishing norms for how failure is handled. What are you going to do if a mistake is made? What do you expect when a mistake is made? Really important to establish those kind of norms. Or are you going to create space for new ideas? Even the wild ones, even the ones that are way outside the framework that you have set, even outside the box. If you create that kind of space for new ideas, maybe you are having them do it anonymously first, and that's okay. That could still be a safe space, even though there's some anonymous flavor to it. And then you can build from there by creating a safe space for people to say something out loud where people know who they are. Okay. Or are you going to embrace productive conflict? We're going to have conflict on teams. We are going to have times where things are not going smoothly. This happens in family teams. This happens in clinical teams. This happens in hospital teams. This happens in office teams. Whatever our team looks like, whether our team is 2 people or whether our team is 18 people, it doesn't matter. There is going to be some conflict sometimes. As we embrace it and say out loud, this is what we're going to do. This is how we can figure this out. And this is how we're going to move forward. We don't want to keep rehashing everything that's happened and why it happened, because we're acknowledging that we've made a mistake and we're acknowledging that there's some conflict. But now we're going to embrace it and move forward. And we're going to use our different ideas to push us forward to the next steps. I'm going to walk you through just a few of the resource slides, and then we're going to come back to this discussion right here. But this is the slide I wanted to show you of Sundar Pichai, the CEO of Google and Alphabet, as he talks about appreciative inquiry, and he's got some really great blog writings. And then also I wanted to introduce you to the Fearless organization, where we got a lot of our material from Amy Edmondson. You will have references and resources here that you will be able to easily click on once you get the slides. And I want to make sure that you get continuing education credit if you would like it. So you can just take a quick picture of this, or it will be sent out with the slides. I also want to let you know that we do have a health sciences YouTube channel where you can see a lot of professional development. Poonam Sharma has a lot of great material out there because she is a certified coach. She works with physicians, she works with faculty as a coach, and she's got some really great YouTube videos, TikTok snippets, and some things on LinkedIn as well. So I wanted to make sure that you had all of that material. And then let's just go back to our questions here. And I would love you to, we've got about 6 or 7 minutes, and I would love you to unmute and to ask any questions or have a discussion. And it doesn't mean I'm going to have answers for you, but it does mean that we want to hear from you. And there might be somebody on the call that does have a question or an answer for you. And if there's no questions, that's okay. Do we have some in the chat? People talking about demonstrating humility, what that actually looks like. Actually saying it out loud, right? Demonstrating humility is saying it out loud. I'm not sure if I know the answer to this, but we're going to find it out together. And somebody else says, we talk often about setting the stage at orientation for our learners, right? We put so much emphasis on orientation, that orientation week and orientation day. But any research on repeating standards and norms with each new leader and instructor? That is a great question. A lot of the research, the resources that we shared with you are going to be situations outside of the orientation piece because we forget sometimes, right? We have orientation day or we have orientation week and we are just being hit by water from a fire hose with so much information if we are the learner in that situation. And a lot of things we may forget. Who can we go to? Or what are the procedures? What's my framework? What's my point of view that I need to be using, right? So a lot of those resources on there are for outside of the orientation situation. Got a few other comments. Any other questions? All right. Thank you, everybody, for being here today. We'll get all the video and slides out to you as soon as possible. Thank you.